anything, it can be anything. But I mean, when I looked at the job description, which I did, like I said, it was probably 2 o'clock in the morning with a baby on me at the time. So like I said, I was trying to say, I barely remember actually, but I remember saying, look, this looks really, really good. It looks really great. The team was actually what appealed to me.
Hey, my fellow doctors, what an episode we have lined up for you today. So you may be aware about an ongoing debate between doctors and companies about how senior do you need to be in order to work at a senior level in any organization. For example, a health tech company. And it's a really interesting question because one would think that you would need to be top of your game, post-consultant level specialist to be of any value to society. Well, that's what healthcare, or I say public healthcare, has essentially told us indirectly. Hence why a lot of people do continue with their training, even if they're not happy, because they feel that getting to the top of that conveyor belt will mean that they've reached the promised land, as an example. But from what I've seen and observed, that is definitely not the case. So in order to address today's question on how senior do you really need to be to become a chief medical officer, I have the pleasure of introducing to you Dr. Johnny Andrews, who in many ways is also part of the furniture of Medic Footprints, but is also the Chief Medical Officer at Certific. More about Certific later, but one of the interesting things about Johnny is that he has definitely been about. So he actually left conventional medical practice, not for long, after foundation year 2. So that's 2 years postgraduate as a doctor. And he's done a huge range of things in and outside of the NHS to really build his portfolio. And this is not his first, but his second chief medical officer role. And I would love you to have a listen to this and reflect on it for yourself. Because if you are someone who is looking to work at a senior level, think about the questions or even the unhelpful things that you may be telling yourself that you have to get to a certain grade or level to be of value in society, whether you're working in leadership or not. Because the reality is, I don't think that's necessarily the case. Anyway, have a listen to this really fascinating discussion, and I would be grateful to hear more about what you think. So do send us a line at team@medicfootprints.org. Now on to the interview. Let's face it, burnout amongst doctors is sky high, and we're actively seeking other ways to make the most of our transferable skills beyond the usual career pathways. Welcome to Disrupting Doctors' Careers. I'm your host, Dr. Abena Bubbs-Jones, and I'm on a mission to connect 1 million doctors across the world with the best in diverse career opportunities. So I'm really excited to discuss this question I get asked by both doctors and companies. How senior a doctor do you need to be to become a chief medical officer? So that is a CMO. And joining me today to address that question is Johnny Andrews, who has been, he's been part of the furniture of Medic Footprints for some time now, and actually really lived the alternative careers dream in many ways.
Yeah.
So I basically invited him to have a discussion about this issue that really comes up again and again. So, I mean, let's start with your journey, actually. Because at the moment you're working as a chief medical officer, right?
That's right. Yep.
So tell me a little bit more about what you're doing at the moment.
I think that's probably the best way of approaching it, because I think my journey alone could probably be its own,
that's
own
like
question.
But
if we focus on where I am now, so Zabena, thank you so much for having me on, and thank you so much for the introduction and for this really, really good question, because I think it's a topical question. It's a question people ask me. It's probably a question I even asked myself many times for many different things. And even when I was looking at various jobs and, assisting with recruiting with Medic Footprint, it's a very topical question. So I'm glad to try and lend an opinion. And it is only an opinion. I think there is no right or wrong answer. But yeah, currently
like as you said, there's no like right or wrong answer to this. But what we're drawing upon is the experiences of not only ourselves, but other doctors that we know working at a chief medical officer level. So far away.
So what I do at the moment. So I am a CMO, a chief medical officer of a company called Certific. Certific is a relatively new company. It's a venture-backed startup with renowned co-founders from banking, communications, business, medicine. Started off with focusing on remote diagnostics with COVID testing. And that is something that I will talk about slightly in a second, which is something I set up myself as wearing a chief medical officer hat for Effect Doctors, a previous role. So I came on board with experience from having set up COVID testing, experience in kind of all the regulation and setup of, essentially setting up a medical laboratory to UCAS accredited standards, CQC registration, all that kind of regulatory experience, some business development experience, and came on to this company where we are now moving onwards from COVID and expanding our product line with other remote diagnostics. The role itself is medical, and obviously being a GMC registered doctor who still does some practice in the NHS, so namely urgent care and A&E shifts kind of on evenings and weekends at the moment. I bring in my insights from the NHS. I think anyone who has or is working in the NHS will know that there are probably 1,000,001 things that problems, and where there are problems, there are opportunities. There are things you can fix, and these can form businesses. They can form startups. They can form brilliant projects, ideas, quips, whatever you want to do. I think that there's that ability. But I think I get a lot of ideas from there, and I bring that into the team. And I think that was one kind of value add that I could add. We are a European startup, so mostly, HQ is Estonia, and there's a small team over here in England. But we obviously have a huge focus on England because Dr. Jack Reindler, who's one of the co-founders, obviously is London-based with obviously international startup experience, but obviously London-based practice. So I think being a UK doctor, knowing the system, just like Jack, a large focus is obviously on the UK, but we're thinking more globally. So I don't have all the attributes, but equally, this is the question: what are the attributes you need to be a CMO or to be a good CMO?
Obviously, you've worked at a CMO in two very quite different companies now, both within the health space. When you were approached to apply, you were approached for both of these, right? So when you're approached,
that's right, actually,
essentially for both to apply, what were they selling the job as? Chief medical officer, as we know, can mean a lot of different things in a lot of companies, right? The common thing is usually that you're a doctor, but what's expected of you can significantly vary. So can you give us an outline of some of the similarities of what was required in both roles, and also some of the differences, kind of high level?
So I think every job, every business, every startup, every company is going to have a different need that they need filling. They're going to want something specific to what their USP is. So if I speak about my two
unique selling points, let's try and reduce the acronyms.
Reduce that. My life is full of acronyms at the moment.
Unique selling points.
Unique selling points. So it completely depends on the role. So with Effect Doctors, Effect Doctors is a startup that Abeni, you'll probably remember, we were working together with them, with the two Wills, the co-founders, with kind of recruitment with Medic Footprints. And I started working for them, and it soon became transparent that, soon became apparent that actually, we needed to up the game in terms of what we could do as a business, as a company. And there was obviously regulation involved. There was CQC that at the time wasn't needed for many of the aesthetics offerings, that still is the case. And that was something I had a tiny bit of experience because in my backstory, my parents were at one point involved in managing a nursing home and some children's day nurseries. So they were used to Ofsted and they were used to CQC. But my dad comes from a engineering and business background, so he is not medical at all. So all of these things were quite new. Being a son who obviously at some point was always at home during my holidays from medical school, would just kind of pop into the office, and he worked from home for most of the time. Was well, I've got these paperwork to do. I need to write these policies. What are these things? What are staff appraisals? What's mandatory training? And soon I kind of learned a little bit about what the regulatory stuff for that was. So I used that as, I guess, leverage to approach the team and said, look, we need to push for gaining CQC registration for Effect Doctors, and that will enable us to become a more, well, it has so many benefits which I won't go into. CQC is a separate topic in itself, but
it had medical officer or designated chief medical officer to apply for CQC.
Well, yes and no. I mean, you need someone who is going to take ownership or leadership, and I think coming back to the question that you raised, I mean, CMO, by definition, it's kind of C-level or C-suite position. So you are an executive in the company. You are someone who is a leader. It is a leadership role. You will have managerial responsibilities, but depending on the size of the organization, you may not have deputies or staff below you. I mean, we very much with Certific, for example, there is structure and there is a team, but the core team is still at the moment 30 people. It's growing, and it has been growing out of from a very, very small number of people only about 18 months back. So as teams grow, yes, you do need more structure, but we try and operate in a flat hierarchy. But
so just to go back, just to clarify, so for Effect Doctors, the CMO opportunity came about because of the push and the need for regulatory requirements for the business. And
yes,
so
I mean the CMO
predominantly overseeing that element.
Yeah.
Or
the funny story,
other leadership.
The funny story there is, and maybe this is maybe more true for me, but I think there's a valuable lesson here. I think it came out of me actually kind of slightly asking or pushing for it. It wasn't. You're quite right. I was kind of approached for that. I was working with the company and they said, "Look, Johnny, we want you to be involved more and more." And I essentially pivoted what was the opportunity to become, say, a full-time employee, to actually say, look, I still have other things that I'm doing. I'm still doing NHS work. At the time, I was quite active with clinical trials, so I was working with hVivo, and I was also doing some work with Medic Footprint as well. So I was trying to maintain a portfolio career at the time. I also had very set commitments like wedding, which was impending. So for me, it was also kind of balancing time, having a bit of fun, learning some skills, utilizing myself, and maximizing my time, but also maintaining lifestyle balance. That kind of said, look, I can do this, but I will. This is what I can bring to the table, and I guess it wasn't like what role should I be? Can I be the chief medical officer? It wasn't that at all. I said, look, this is what we probably need. We need a leadership person. I'm happy to take that on board. For CQC, I'll be the registered manager. That's the term, or the nominated individual. And then I said, look, what role should I have? And we already had a medical director. Said, look, why not the CMO? And it was just sat there, kind of with a beer in hand, kind of very informally saying, okay, look, this is how we're going to approach it. So that was kind of a more casual arrangement.
I was going to ask you another question that you actually interestingly brought up, but just let's quickly go back. Quick answer. How many years post-grad were you when for your first chief medical officer role? So you'd done your F2.
Sure. Well, where was I? I was in F4, I guess, is the equivalent. So I was in my 4th year of being a doctor, so about 3.5 years post-qualification. So it would have been, I guess, if you like, I assumed the title in January 2019, something like that.
So just interestingly enough, you had not done any membership training or exam.
I think I was sitting you probably even remember this. We were doing crowdfunding, and I was sitting maybe like MRCP Part 1 or something like that.
It doesn't sound like the decision that was made for you to become a CMO was related to much about what you'd done as a doctor, other than, yes, you are a doctor and this is how you're part of the company, essentially.
Absolutely. But I think in that particular example,
experience and your background and your exposure to the regulatory aspects, and also you were very motivated and proactive in having that conversation and adding value to the company, that eventually after negotiations you actually got to that point. Am I right in kind of summarizing that?
Yeah. I think that's fair.
I just want to highlight that as an example, because we have a lot of doctors in particular who are like, they hang on to, they desperately want to leave for whatever reason, medicine, but they feel like they have to hang on and stay for X number of years because they won't be seen as credible otherwise. And, through Medic Footprints, I've seen doctors who have progressed exceedingly well without having ever worked as a doctor. Like, they graduated and they've said, I'm not doing any medicine. And they're doing really well. I've seen doctors at the other end who, yes, have done their CCT and then went on to be CMO. But I just want to use that as an example of, you did not have to do any more tick box qualifications to get that CMO post.
No, but I think that is a very unique example. In fairness, I mean,
it is and it isn't, because I've had that story in various themes numerous times, but I just wanted to really kind of just summarize that. And my next question was, it's interesting you mentioned there was a medical director in the company. What was the difference between a medical director and a chief medical officer?
That's a really good question. I mean, it completely depends on the company. And I think what my experience and what I'm talking about with both companies, Effect Doctors, Certific, and many other companies I've even done some work for or in, these are startups. When you're talking about, say, when I was working for a CRO in clinical trials, there's a different expectation for a CMO, medical director. And that is partly industry driven. So, in pharma, the expectations will be more in line with what trial experience someone has. And perhaps all the other bits that I've mentioned. So someone might have more of a regulatory hat on. Someone might be more of a hands-on physician or signatory. Someone might be still an active clinician with a particular area of expertise in a particular disease group. So if it's, say, oncology related and you're an oncologist, then it makes a lot of sense that would be someone who is in a leadership position. But they might also be the principal investigator as well for that particular organization. So I think industry is one thing. Size is another thing. I guess, and probably not notwithstanding the age of the company, because obviously typically the companies that have been around longer are generally bigger. That's not always true, but whereas startups, as you know, can remain very, very small for many number of years, they can also scale incredibly quickly, and they can, if they're VC backed and they raise a lot of capital, they can hire aggressively to scale accordingly. And with that, and when you hire, you obviously want to hire the best, but you will need multiple skill sets, and it completely depends. So I think startup is unique, and it's very much depending on the needs of that particular industry. But so I spoke about Effect Doctors example. With Certific, it was a completely different process. I was reached out by one of the co-founders on LinkedIn. I actually was aware of the company because, like I said, through Effect Doctors, I set up COVID testing.
And then that was, you mentioned Dr. Jack Kreindler.
That's right, yeah.
Right. Again, you're like, why would he need a chief medical officer for?
Well, that's true. And I think that is in line with growing and scaling a business. So he started off as one of 3 co-founders. So he wore the CMO hat or medical director, and he was involved in all things medical, regulatory, as well as business development and everything else. But there comes a point where you grow a company, and you need to focus on other areas of the business. And that was actually, on our first call when we spoke about the role, that was where he said he wanted to free up time essentially to be able to focus on other areas of the business. So he is now Chief Scientific Officer, and that is more based with, yes, he is a doctor. Yes, he still does medical things outside of Certific and inside of Certific, but he also is quite active with Certific and work that he was doing at Imperial College with some research. And there is a lot of what we are doing with Certific, being a remote diagnostics company, is obviously in the medical sphere, but it's also in the scientific sphere as well. So it's trying to meld those two kind of worlds. And he's quite lucky to, I guess, wear more than one hat, but hats on from both sectors. And I think he wants to focus more on that, but also business development, as well as providing medical oversight as well. So I think there is
just for your, going back to your role in particular. Yeah, what skill sets do you need for your current role as CMO, like day to day?
Well, what skill sets I need, what skill sets I had, what skill sets I probably will
Let's start from the beginning.
develop.
So, your approach to this role, what was it sold as in a nutshell, high level?
In a nutshell, it's all thinking through memories that, admittedly, I've been doing this job now for not even 2 months, and it's been busy. I've also been doing A&E work as well on the side, and also having a baby, so it's all a bit of a blur. But
is it what you expected from what you were told? Is it kind of
100%? I am very familiar with. I'm very familiar with in startup being very, very variable in what an expectation may be, but actually you just need to be flexible. So I think there are attributes that are relevant to maybe a more leadership title like a CMO, and there are attributes that you just need to have if you're going to work in a startup, even if you're not going to be working as a CMO, for example. So if you're a doctor and you're looking to join a startup, I think there are certain attributes that one needs to have, which are quite different to working in healthcare, in traditional healthcare. And I think flexibility is probably one of the biggest things. And flexibility also comes with the role. So you might be sold, look, you'll be not sold, or you might be said, look, okay, things you will be expected to do and need to focus on are medical oversight, regulation, and compliance, business development with regards to anything medical, sales, networking, partnerships, anything. It can be anything. But when I looked at the job description, which I did, like I said, it was probably 2:00 in the morning with a baby on me at the time. So like I said, I was trying to say, I barely remember actually, but I remember saying, look, this looks really, really good. It looks really great. The team was actually what appealed to me. For me, a lot of this stuff is words, especially within the startup world. A lot, again, maybe it's unique experience because I've come from it from having looked at a lot of jobs, having applied for a lot of jobs and done a lot of different jobs, medical and otherwise, over the years. And also with Medic Footprints, actually working with companies and actually seeing what kind of jobs, job descriptions. I've looked at hundreds of job descriptions. So when I see words, a lot of people say the same things. And I know in reality that, especially in startup, it's not always going to be that. But I'm happy with that. I'm okay with that and on board with that process. But come back to kind of your overarching question. As a CMO, I expect that it's a leadership position. So I'm expected that I will need to make decisions. And there is M in the title, or medical. So it is a medical role. So I'm expected to use my doctor hat and think like a doctor and provide my opinions, my advice, and anything I do has to reflect me as a doctor. So I utilize my experience gained from NHS work. And you're right. I've not CCT'd. I never even applied for training. Well, sorry, that's not quite true. I only applied for training very recently. I actually had finally decided I'll go for GP training, and then this offer came up, and then I declined GP training to do this. But I had years out.
I also nearly applied for it. Well, I did it, or semi-applied for GP training at one point, like we all did, probably twice. and it always didn't work out, but I was always relieved. I was always relieved because I knew just GP was not for me, but it's always a great kind of fallback option.
It's a great fallback, but I haven't ruled out going back into to potentially do CCT at some point. I also had
CCT.
Well, this is the thing. I mean, potentially general
why
practice.
Is that important to you? Just curiosity. Because obviously now you're really kind of, I say, in the thick of it. To some degree, you are.
Yeah.
Working in industry, and I can personally see you kind of growing your network. You're a very good networker, and just stepping from one country to another potentially, right? Because you are on that trajectory. That's the way I see it, anyway. Having known you for several years now. So going back to any sort of training, doesn't matter which specialty, is a huge commitment and a huge lifestyle change from the flexibility and autonomy that you have now. So I mean, I know this is slightly off topic, but why is it important to you to?
Not at all. I think this is a very important message. I do love clinical practice, clinical medicine. So like I said, I now do shifts in urgent care alongside GPs. So, and I also do A&E. But I'm very fortunate to be able to pick sessions. So I only can do 5 hours at a time if I want to. And I do that in evenings, and I do that on the odd weekend, alongside a full-time role as well. So I really just value those few hours spending some time with the patient, doing a bit of examining, doing a bit of suturing.
Why CCT, Johnny?
Why CCT? That's a really good question.
Very different from clinical work.
It is. And I think there comes a point where, and as you probably remember, I've dipped in and out of the NHS for the last 7.5 years. And I never had ambitions before. I was like, well, training, I didn't even want to apply. But I think it's come to my mind in the last 12, 18 months that I would, a part of me does kind of yearn to, maybe accomplish more. Maybe it's the sense, maybe it's a want to, as part of being a medic, to always be a high achiever or always strive for something further and beyond where you're at. And like I said, it's nothing I've got on the timeline. I'm committed to my current role 100%. In the long run, and as far as that will take me, but I think this will be something I would even consider doing in 5 years, 10 years, or something like that, because I quite like and a part of me would quite like to actually just get back stuck in doing some clinical practice full time, but I don't envisage doing that anytime soon. I'm very happy with doing a bit of part-time clinical work at the moment. So it's something I've not ruled out. It's something it's like I
hear a bit of conflict, and it's one that I recognize because I have been through that as well. And as I've been straddling between training, because it's really actually about training and becoming a consultant. This is what it's about, because not everyone has to become a consultant. I know most of us sold that dream, but we all know that a lot of consultants or people at senior levels, particularly working in the NHS, it's not as rosy as it used to be, let's put it that way. But that still doesn't mean that you can continue working clinically, seeing patients, developing your experience working at senior level, but not necessarily being put on the specialist register. And, I chose to keep going as well and finish. I remember having, my mum's voice ringing in my head saying, when are you going to finish something, Abena? When are you going to finish something? And this is me having gone through surgical training and urology training and occupational medicine training whilst running a business. And yes, I quit my training in OcMed a year before I was due to finish. Mm-hmm. But that was a very conscious decision because I knew I had another option, which was to finish down the CSER route. So that's the and I'm still on the specialist register. Yeah. But did I need to do all that? Probably not, especially in occupational medicine, probably not. But anyway, we've only got a few minutes left, and going back to the core question. So for those doctors who are, nearing the end of their training or already consultants, what are the benefits of then moving into chief medical officer roles at a later stage in their medical careers? from your experience, what are companies looking for? So, for example, what I've seen in the market at the moment is you will have companies who, for example, I've been talking to one company recently who wanted an endocrinologist to be an ambassador for their company, do the kind of media rounds, the Instagram lives, all of that jazz. Why an endocrinologist? It was basically something about diabetes.
Sure.
But I mean, reflecting on their actual needs, I mean, because the company originated in another country where the system is different and there's more of a focus on specialisms, that's why it seemed more appropriate to get an endocrinologist, because that's what they're used to. But realistically, you don't always need an endocrinologist to be specifically talking about diabetes. There are lots of doctors with a lot of experience who could be talking about diabetes. If you look at, say, a lot of our kind of media doctors, most of them are GPs, right? Being a specialist in pretty much everything. But that's just one example. But I'd love to hear your insights as to, what happens with doctors later on in their careers and then moving on to chief medical officer. How do they appeal more so to companies compared to doctors who are more junior?
If I can say one word, it would be confidence. Okay, and I think confidence or self-belief, and I'll elaborate on that now for the rest of the last few minutes. But I think any doctor can do a number of roles, and it might be a CMO, which is, some people would deem it as kind of the top or pinnacle role for a doctor in industry, for example. But and so it's very logical to assume that you would be at the pinnacle of your medical career. Is it necessary or mandatory? Absolutely not. Is it helpful? I think we've discussed a couple of areas where it could be in established industry, in pharma, in especially where it's very niche. So certain sectors where there's maybe a disease focus or interest. Oncology, immunology, hematology, neuro. I mean, any and every specialty has a focus, and there are pharma companies, there are medical device companies, there are startups that are focused on any of these specialties. So yes, if you are a specialist, CCT at that, or you are even a doctor who has done some training towards that. It might be core medical training. With a focus on neurology. It might be surgical training, but you've done more urology. You can always capitalize on these skills. So confidence and self-belief, it's how you sell yourself. You need to find what is on your CV to be able to identify those things. For me, it is, I probably haven't even done myself justice to elaborate on the bits that I had and I used to sell myself and continue to sell myself. And that comes from also working in corporate sales before becoming a doctor and having business development insight, having done regulatory stuff, and obviously being a practicing doctor. That's what I bring to the table. But yes, some jobs, if it is a particular specialty, it might benefit if you have experience in that. But do you have to be CCT in it? No. You could be a GP and with a special interest.
Because I find that a lot of companies do fill in that gap. So they need a specialist in a very specific area. They can go and find that specialist and get that specialist opinion. But they don't necessarily need the chief medical officer to be all of that and everything else we've discussed in this podcast, which is the leadership stuff, the regulatory stuff, the hands-on stuff. And so sometimes I give advice to companies that just think about what you need most of. Yeah. And then outsource the rest, because especially the more specialists you get, the more challenging is that, because the pool is going to be smaller to find that one special unicorn person who is a proper specialist and not doing and has a full-time availability to work as a chief medical officer. There are people there, but
the chances are they probably don't exist. And like you say, unicorn's the perfect example. They're probably one in a million. Exactly. And the chance that you connect those two people, it's very much like a fairy tale, isn't it? I think, kind of a parting comment on this question. I think, any doctor can apply for any of these roles. I think go for it. Find the bits in your CV that would position you as a leader. build on everything that you've gone through from medical school, training as a junior doctor, hopefully your experience, hopefully in various healthcare systems. It doesn't have to be the NHS. Experience of even healthcare systems in other countries is useful. Any experience.
I remind people all the time, just think about what you do outside of your job, outside of medicine. Like, as you've illustrated, Johnny, you know, your father works in business and engineering. So even your exposure to that and your insights from that has been valuable in your career pathway. So think outside of the box, guys. That's all I have to say, because that is your unique selling point. That is what's going to make you stand out from every other doctor who might be going for that role. But it is how you communicate the experience and the value add you can bring to the company. But anyway, thank you so much, Johnny, for joining us on this really interesting, insightful conversation. And I hope that everyone listening found that useful. And we'll try and get you on for another question. I'm sure there's a lot we can explore together, right?
I'm sure. Look forward to it.
Thanks. So how senior do you need to become as Chief Medical Officer in any sector, not just health tech? And I think the real answer is there is no right answer for that. I think the real key is learn how to sell your unique selling points. And that will get you into a role where you can thrive as the leader that you are as a doctor in whichever sector you choose. Anyway, any more thoughts on this, please send us a line at team@medicfootprints.org, and do that after you subscribe and leave a really positive and glowing review so that this can be shared throughout the networks in the UK and beyond as widely as possible, because we want to make sure that we are connecting at least 1 million doctors with the best in diverse career opportunities and make sure that they have the right mindset to succeed. Our deadline is 2030. We're getting there. Until next time.